chiropractic is growing and developing into more of an evidence-based practice, may I say. So using the technology, using the research in order to advance. Besides, there's some studies in chiropractic that really believe that chiropractic care can heal other things, more or less, like cure cancer or something like that. But the biggest thing is that's not how I practice. I really focus on really honing in on evidence-based practice and how can I give people the tools in order for them to develop to the best of their ability.
What's going on, everybody? Welcome back to another episode of the B4Real Podcast. Today we have Dr. Kamon Darby, chiropractor, with us today, man. How you doing?
I'm doing well. Thank you for having me, bro.
And as we do normally, we want to get your story and learn more about you, more about what you do and the importance of it. So we're just going to dive right in. Give me a little bit about your start in. Let's just start with high school, the sports and stuff you played and things like that. What led to where you are today?
Yeah, man. So played high school football, ran track. I dealt with a lot of injuries throughout the process of running track, pulled hamstrings, and then as far as dealing with injuries when it came to stingers with football. But the biggest thing is I know I always wanted to be in the healthcare field. So I was part of the medical magnet program at Central High School.
So you knew you wanted to be in the healthcare field from high school?
From high school, yeah, for sure. Just didn't know what direction I wanted to take, honestly.
So being in sports led you to that? Yeah,
sports kind of led me into that. So I was blessed to play college football at McNeese University right there in Lake Charles. And the biggest thing was that I know I wanted to go into sports medicine. So that's what I had a concentration in once I moved into college. And then towards my senior year of college, what happened was I ended up interning with a chiropractor. And he was a family chiropractor. Wasn't really sports oriented, but really focused on just taking care of like just the whole family, right? Just giving out the adjustments. And I was like, man, I can really do this for the rest of my life. And then as I furthered into chiropractic school, when I went to med school at Texas Chiropractic College out there in Pasadena, that's when I actually got exposed to what all chiropractic can be. You know what I mean? So that's when I kind of knew that I can concentrate into sports and then also tie back into just being a chiropractor.
So being into sports, like having those injuries and things like that, let you know that there was an avenue for you to help athletes and people who are trying to perform at the highest level.
Oh yeah, for sure, man. That's the goal, man. Is honestly, I'd always wanted to be around sports, bro.
So that's like a double. Like, okay, the dream is always when you're in high school, middle school, okay, you want to make it to the league,
right?
But the ultimate dream is just to be into the sport field any way you can. So it's like you get to be around these guys, be around these athletes, and also stay in the sports realm of things. But you're just having a different approach, but you're still in it.
Right, for sure. Yeah, it's a blessing, man. Because at the end of the day, man, when I'm talking to like high school guys, right, I can talk from experience instead of just saying, oh man, I ain't never dealt with a hamstring strain.
Exactly.
I ain't never dealt with this, but I can really talk like, hey, look, this is what's gonna help because I've been through what you've been through.
And then not only that is you're able to have those conversations that's outside of injuries and health too, like what you're going through mentally as well, like trying to be the best athlete possible because like you said, you've been there.
Oh yeah.
So you can talk to these young guys and say, hey man, hang in there. Or if they're having any type of troubles, you can be like, man, I went through that.
Oh yeah, for sure. Especially from the recruiting realm, bro. These guys, like I mean, obviously I didn't have offers from like Alabama and Ohio State, but by all means, I had a couple offers from the Southland. So even going through the recruiting process, that's a mental process because man, you're performing at the best of your ability in high school and you scoring touchdowns or you catching interceptions. But when do I start getting recruiting? But even from that realm, I can relate to my young athletes.
It's crazy how you're a chiropractor, but just me being in your office and watching you do what you do, I noticed that you're a chiropractor, but also like a therapist as well. Because y'all get in there and y'all get to talking about stuff, life and things like that. Like, it's like going to the barbershop. He's a barber, but hey, we having these conversations while I'm doing your cup and adjustments and all that type of thing. So how important it is for you to have those relationships with your clients and the people that you work with?
Man, it's very important, man, because honestly, one thing you got to do is build trust with patients. And the biggest thing is I want them to trust me from every aspect of life. Obviously, they're trusting me with their body, but by all means, I got to be able to connect with them on another level. And the reason why I say that is because honestly, when I went to the doctor, I wanted to be able to relate to my doctor. I want to be able to like tell you something, and then I feel like you're giving me positive feedback from experience or positive feedback from somebody else's experience. So building that relationship that I have with my patients is just very important to me.
And then I could just imagine being a 17, 18, 19-year-old walking into your office and going for for the treatments, and I'm just seeing your things that you've done on the wall. Like you've been there. You've been the sports guy. You've accomplished things in life that they're trying to accomplish, and that, like you said, that's being more relatable. Like, okay, he's just not a guy that woke up one morning and said, I want to be Dr. Darby, I want to do chiropractor. No, he's in there because he has experienced the things that I'm experiencing.
Right, for sure. And I feel like, honestly, I got to give God the glory for it, bro. That really led me into that. You know what I mean? Because at the end of the day, I didn't know nothing about chiropractic. I ain't go to no chiropractor growing up, but honestly, like you said, just being relatable and honestly being able to connect. Because I'm old enough to be some of these people's older brother. Like,
it's hard that, like, I was just talking to a friend about it the other day. Like, we low 30. I just turned 30, and it's like we don't feel old, but you old enough to be some of they.
Yeah.
Pops,
I'm like right there.
You're right there. Like, because I was playing basketball the other day, and I was like, okay, you hold him, you hold that guy. I was at Rogers Park, and then the guy, after I told him, I was like, he said, yes, sir. I'm like,
oh man.
I'm like, yep. Okay.
Hey, I ain't even gonna lie.
And he was like 19, and I'm just like,
oh man. Nah, I ain't gonna lie. Some of my high school guys, like some of the guys I started working on last year, I told them not to call me sir. I'm like, bro, like, I understand it's a respect thing. You were raised right.
Well, we don't need that.
No, I don't need to be called sir just yet,
give
man.
me to 45.
Yeah, give me
40, 45.
Me. I got a one wild to 45 by all means.
And I want to cherish every moment of that. Just lay off with the sirs.
Hey, facts.
Right now.
Facts.
But let's talk about into the sports realm. What is the importance of going to somebody like you, a chiropractor?
So as an athlete, man, it's very important to go to a chiropractor or somebody that's working on muscles, that's doing some type of mobilization. So PTs can also do that as well. OTs a little bit, but from a chiropractic realm, being a sports chiropractor, is very important to tap in with a chiropractor. Reason being is because honestly, you're training every day. Mm-hmm. You're focusing on training every day. You're focusing on perfecting your craft, whether it's a football guy that's just trying to work on DB drills, or it's a softball girl just want to work on her swing, right, or the way that she throws. The biggest thing is when you relate and you tap in, or when you associate yourself with a sports chiropractor or somebody in the realm of sports performance, then you're making yourself that 1% better.
For somebody who doesn't understand like the tactics that chiropractors use, can you explain one by one the top 3 things that you do? Because I know the top 3 things are the scraping, the cupping, and the adjustments. Can you explain each thing and what they do, and how do you go about doing these, and what they make better, and what, you know what I'm saying? What's the benefit?
Right. Okay. So biggest thing as a chiropractor, we watch all these ASMRs on TikTok and social media. The adjustment is really just mobilization. All I'm trying to do is establish range of motion within joints. So
when you're doing like, the hip, and are you putting that, the pop, is it because you putting it somewhere where it doesn't normally go? Like, what is the pop?
No. So the pop is just air release from a joint. Okay. So it's like gas release from a joint. The proper word for it is cavitation. So the biggest thing is most people think that I'm moving bones or I'm scraping bones on bones, but that's not the case. I'm not popping bones. It's just cavitation. It's just a gas release from joints.
And it's good to release that.
Yeah, for sure. Because then it just kind of promotes range of motion.
But the thing about it is, like, because I pop my knuckles, like, boom, 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 and people say, they said it's not good to do that. And so what's the difference?
It's not a bit different. So the popping noise that you get from the knuckles are what's the gas, is this gas release from joints. Same thing what I'm doing when I'm mobilizing the spine, the ankle, the hips.
So keeping the gas and not releasing it, that could cause an issue?
Not necessarily cause an issue. It just kind of helps promote range of motion.
Okay.
So it's just a secondary response. The gas release is not associated with the pain to a certain extent. If that makes sense.
Got you.
Yeah, it's just, I'm adjusting you to promote range of motion, and then you get a cavitation secondary to me adjusting you. It's just, we use that as like a marketing tool, or people because people like to see it. People like, that look like it feel good.
The pop isn't necessarily necessary. It's not necessary.
No.
But the bending and the pushing into those positions, that's what's necessary.
Yeah, necessary to promote more range of motion. Yeah. So sometimes I get a older patient or an older athlete, may I say, that that typically don't pop. Like you don't hear the cavitation, but they get up feeling better, moving better because again, we're taking the body through a different range of motion that is not normally being taken through. Just like when you stretch a muscle, you're taking you're taking that muscle and you trying to elongate it more or less.
Got you. So that's the adjustment aspects of it. Let's talk about the scraping. So what exactly does that do?
So scraping, I'm gonna kind of combine scraping and cupping. So scraping and cupping is basically to address soft tissue. When I say soft tissue, addressing muscles, addressing fascial lines, may I say. So when you think about it, we have skin, fascia, and muscles. So that fascia is that thin layer in between skin and muscle, and all we're trying to do is mobilize. All we're trying to do is elongate, create damage to promote blood flow. And as we promote blood flow, then we get the results that we're looking for, which is just healing.
So when you say create damage, like that puts me in mind of like a derma roller. Because it damages the skin in order to promote hair growth.
But
so it's like kind of the same, like you're tearing something down in order to build it up.
Yeah, so that's more of on a superficial layer where we're talking about skin.
Oh, but you're
versus I'm getting deeper. Yeah, deeper as far as like deep tissue, may I say. But like cupping is just like more of just moving fascial lines. It's not. It leaves the more hickey marks, may I say.
Yeah.
And that's still on more of the superficial level, like you would say.
But it's doing something deeper than that.
Yeah, for sure.
Okay, got you.
The object of using the cupping and scraping is just to get blood flow to the area.
Got you. So all you're trying to do is just basically the majority of what you're doing is just getting that blood flowing and getting those muscles moving in directions that you might not normally move, and just making sure that you're able to do it when you need to.
Right. Exactly.
Got you. So what's some of the most problems that are issues that your clients come with you saying that they're facing?
I would say mostly I deal with a lot of sprain strains, a lot of like, oh, I stood up and I had an athlete just the other day, or like right now in season, it's track season, right? So I'm dealing with a lot of athletes who's dealing with a lot of hamstring sprains. When it comes down to a hamstring strain, I also use dry needling. I don't think we discussed that the last time. But dry needling is also a tool that I use in order to just get blood flow to the area. I'm creating a lesion within the soft tissue to get blood flow in the area, and it helps promote that healing process. But again, like what I'm dealing with right now is like I said, a lot of my softball and baseball guys, softball girls and baseball guys who are coming in from Orm Care. And again, I'm using the same tools, dry needling, scraping, and cupping, all to just promote blood flow to the area and remove what they call trigger points. So trigger points is what everybody relate to is those knots in my shoulder or knots in my back. And what I use is what I'm trying to do is just remove those lesions within the soft tissue to kind of promote blood flow and just get people to move the way they need to move when they're performing at the best of their ability.
So you get somebody that come in that just says like, I just want to get an adjustment, but is this like, as you being a doctor and everything, can you notice something that they may have not noticed and diagnose something?
Oh yeah, for sure.
Okay. So like, what are some of those things? Like somebody comes in, hey, I'm just coming in for adjustments, but you notice when you have them doing physical things that there's something going on there. So
right.
Like, how do you go about like diagnosing and telling them, hey, you need to work on this and that?
So it different. Since we're talking about sports performance and like me being a sports chiropractor. When I get an athlete that comes in, they're like, oh, I just want an adjustment. The adjustment is just a tool that I use. You know what I mean? But what I do is I take them through an evaluation to make sure that I'm testing the length of hamstrings. I'm seeing how much hip range of motion you got in certain range of motion, because sometimes you don't realize the limitation until I take you there and you're like, oh, well, yeah, I do notice that.
Turn like that.
Yeah, for sure. And then when you get down to the sports performance aspect of it, which I plan to continue to grow using technology and things to also look at different angles on throwing angles, or looking at different hip angles when you're doing a certain functional movement, can kind of help you kind of evaluate an athlete and get them moving in the right direction as far as performance.
And I wanted to ask you this because I know you've taken care of some of the best athletes, and you've taken care of medium, and you take care of athletes that's just trying to get there, right?
Yeah, for
sure.
So
what is something physically that you notice different from these top tier athletes and some that's just, you know, I don't want to say not good, but they're trying to get there. Like, is there anything physically that you've noticed that sets them apart?
You know what's crazy, man? The more like you said, I've evaluated NFL guys.
Yeah, that's what I'm saying. Like, what are you noticing that
the third string quarterback?
All these NFL guys have this, and this. Mm-hmm. That's why these guys are not in the NFL, or this could be.
Well, you know what? It's no big difference.
It's no
bro.
physical. It's no physical difference.
Some of the same things that I find as far as hip limitation, With pro guys, I see that in the third string quarterback. I'm telling you, man.
Oh, man.
And the biggest thing is the bad thing about the NFL guys is they've been conditioned to move as like they're already in their routine. They're training day in and day out. But if you're training the wrong muscles the wrong way and you're creating what they call compensation patterns, or if you're not moving your hips like you're training laterally, like a lot of like my NFL guys, they train up and down. They do the squats, they do the leg press, they got big quads, they got big hammies, but they don't train the glutes. And you know, women, they go into the gym and they train their glutes all day,
every day.
But guys don't train laterally, or they don't use like Vertimax and stuff like that to train laterally. And when you're not training laterally, then you're not maximizing all the muscles that you need in order to perform to the best of your ability. So some of the same things that I see in the top athletes, I see in the third string quarterback. You know what I mean?
What are some, do you think that there's some misconceptions about chiropractors that people think, but they're all wrong about?
Man, a lot, man. As far as they think that I can actually kill them. Like most people come in and be like, are you gonna break my neck? I'm like, no, man. If I broke somebody's neck, you know how long my practice would last? Maybe a couple of hours. But like by all means, my practice would last a couple hours. Done. Yeah, it'd be done. Like if I have one casualty, especially with the athletes that I work with, man, I've been blessed to work with some high end athletes. Just imagine, PJ Locke goes to chiropractor and loses his life. Like, dude, that's gonna be world news.
That'd be crazy.
For sure.
So like, I don't know. A lot of people do think that it'd be like, man, I'm not letting no chiropractor put no rope on my and pull me. Heck no, break my stuff up.
And I normally don't use that technique. But by all means, some people that's trained to do that and that love to do it. Yeah. And it's all for clickbait, more or less. I feel like I don't use that technique because I feel like I can get what I need to accomplish, the goals that I need to accomplish without, for sure.
What are some advances in the medical field as far as chiropractor and technologies and things that you don't have, but you plan and want to do in the future?
So basically right now, I plan on getting other machines like, shockwave therapy, which just targets different tendons, more or less. And then kind of just creates a different advantage besides just doing soft tissue work. But my goal in my practice, man, is just to stay hands-on at all possible. Okay. That's why I'm a one-man band. That's why I do what I do, and I do it by myself. That way I know that I'm giving my athletes the best quality of care.
Especially now.
Yeah, for sure. So the biggest thing is I don't have a lot of like technology that I feel like I'm gonna add to my practice.
Okay. So you would be everything just
hands-on. Like I said, shockwave is gonna be one good thing that I add to my practice. But again, I'm not gonna use that on every athlete. It's just kind of like I said, advancing myself with different technologies and then staying on top of things as far as like they might have something that come out, new research that comes out that proves that, hey, this therapy or this modality can help my athletes, then I'll look into it, do the research, and then make sure that I apply it in my practice to make sure that I'm the guy that people come to as far as the sports performance chiropractic.
I want to backtrack a little bit. I want to talk about college life, becoming a chiropractor. So what's the process like for somebody who's watching that wants to get into that field? Like, what's the process after high school? Of course, college, but like, how does that work?
Right. So the requirements. So I went the route of sports medicine, right? I got a degree at McNeese University for sports medicine. So in that realm, there's a lot of concentrations at different universities that's not called sports medicine. Because a lot of athletes nowadays, they be like, hey, what did you major in? And how did you get to chiropractic school? The biggest thing is just getting the right amount of sciences and looking into the requirements that these chiropractic schools offer. Or you need to get into this chiropractic school, and then making sure that you're taking those classes. Make sure that degree plan in college allows you to set you up for the best success in chiropractic school. But I know a couple of people who were like finance majors that were probably just doing teaching at first as far as a concentration, but was able to get accepted into chiropractic school because they had the right amount of sciences. Just the requirements in order to get into chiropractic school. You don't have to necessarily be sports medicine or any of those within that realm in order to get accepted into chiropractic school. But McNeese kind of prepared me for that a little bit, but nothing really prepares you totally for medical school at all.
Okay, so like once you're in, like what's the feeling and thought process? Is it like discouraging at first?
Man,
was that one of the hardest things you had to do?
Oh, hands down, bro. One of the hardest things I have to do because I did an accelerated program. So the program is usually 5 years, but I did it in 3 years, 4 months.
So total college you have?
So I have total of 8.
Eight.
Eight.
Okay.
And that's including the red shirt year because I did play. Like I said, I played college football at
Yeah,
McNeese, and I got red shirted, and then I almost got my master's while I was at McNeese. But ended up, like I said, getting my bachelor's in sports medicine, and then going into chiropractic school for another 3.5 years, pretty much.
Got you. So a total of 8 years. So right at the finish line, when you're, I'm about to be a chiropractor. Like, what's that feeling? Like,
Man, it's actually scary.
Oh, really?
Man,
you done did all the hard work.
Yeah, no, that's when your career begins, when you graduate. So that was the biggest thing that I was praying about is when I first got ready to graduate chiropractic school. Most people, you have to make this decision: do I go work for another chiropractor, or do I open my own practice?
That's what I was about to ask you. Is like, would it be better to start off working for another chiropractor, more lucrative and more experience?
Man, it just depends, man. It's situational. I mean, obviously, different people are at different points of their life. And at that point in time when you're finishing chiropractic school, whether you got 3 kids, like for instance, I have a colleague of mine who had 2 kids already and then had 2 on the way. So do I go open up a practice where I'm gonna only make probably $100 a week, or do I go work for somebody in order to kind of build that? But the biggest thing is build revenue and support my family. But the biggest thing is they say that the older chiropractors eat the young alive, and what that means is that if you're not landing a job where it pretty much you're not landing a job where it actually feeds your spirit, like like. I wanted to be a sports performance chiropractor. That's what I wanted to do. But most people who have that type of practice already have 2 or 3 doctors already on staff, and they're already, they're not hiring pretty much. So
you have to create your own avenue. Then.
Yeah, for sure. So do I go work for another chiropractor just to collect a check and just adjust people all day, not do the cupping, the scraping, the dry needling, but I'm getting a check, right? Okay. Right. Versus my goal was just to start my own practice, man. I took a leap of faith. God kind of led me into it. And then again, it's been a blessing because I've only been in practice for about 1.5 years, and it's been a true blessing for sure. So biggest thing is, like I said, when you're graduating from chiropractic school, it's really one of the scariest things in life because that's when your career starts. Honestly, that's when the hard part starts because now you have to actually go take the skills that you developed throughout chiropractic school and actually go apply it and actually build a practice, or necessarily build clientele within another practice, because there's different walks you can go into, but we can get into that.
Got you. So let's go ahead and share some of your success stories, man. As far as, like you said, you've been in for, you said 1.5 years?
Yeah,
about 1.5 years. Like, what's some highlights, high points that just make you know that, okay, I'm headed in the right direction?
Man, biggest thing is that I treat pretty much every high end athlete in this area.
Okay.
From the Brock Jacksons of Lumbertons to the Logan Simmons of Silsbee, Texas, and then, like I said before, I mentioned PJ Locke, which is, I play high school ball with him, but I'm also able to treat him now at this point. Yeah. And then like the Graylin Arnolds who plays for the Texans. The biggest thing is my success stories are about like my individual success, as far as an athlete coming to me and saying, hey, I got this better. I felt this difference from coming to you. I felt that when this exercise that you gave me, it really, really helps me get to the next level. And that's kind of like what I take my wins and losses by.
So basically your success story is feedback from your clients and knowing that what you're doing is actually working, and that leads you to getting more clients and continue to do what you do.
Yeah, for sure. Like, again, like I treat a guy named Draylon Miller, like from Silsbee, Texas, and the biggest thing is honestly, it's a blessing to be able to give give treatment and then give a piece of knowledge that most people haven't been exposed to. Because again, I'm some of these guys' first chiropractor ever in life, so giving them tools, but also providing treatment. And then when they come back to me and say, hey, I don't feel this pain anymore, or I feel like I got more range of motion in my hips because of this exercise, that's kind of where my success stories lie. Versus, like, I mean, by all means, I've treated like PJ, and I've actually been able to go to Denver and treat some of his teammates.
Yeah, see, that's another thing. And then as far as like, let's talk about that. Like, how important is networking in this business? Because,
man, it's big.
Man, you meet people like, even just going out there to your space and helping you out, that's networking in a way, because you meet people and then they help you meet people and they help. That's how you get known. So how important it is, networking and things like that.
Man, it's big, man, especially when building a practice, because honestly, nobody knows about you until they see you.
Exactly. So that's what I tell people. I tell people, they say, I don't want to go there, I'm not getting paid for this, but nobody's gonna know if you don't get in those spaces. No one's gonna know you. People think that payment is always money.
Right.
Payment isn't always money. No. Sometimes notoriety, like getting noticed. And sometimes you have to wake up early in the morning and go somewhere that you're not getting paid to go.
Yeah, for sure.
Because you need to be in the space.
It's part of branding, man. It's part of just building a practice. And it stretches beyond just chiropractic or building a practice. Anything, just entrepreneurship, just branding yourself by all means, even putting yourself in a position that may even require you to make a career change. But you put yourself in front of the right person, and you may miss your calling if you don't go out there and do
exactly. Because like just the other day, man, I was supposed to go. It's this lady, her name is Jasmine or something like that. She's opening up a collab studio. It's a studio for photographers, and I had to be there, but the guy that I was going to be there with, he wasn't answering the phone or whatever, so I didn't have to go. But I showed up anyway, and that led me to her introducing me to other people that need stuff and things like that. So I tell people, anytime that you can be somewhere, be there, and also anytime that you can get someone to see your logo is a win.
Oh, definitely.
Anytime that you
That's why everybody, I go to softball games and baseball games, and I got these black scrubs
on. It's a conversation starter. You never know. They might, especially you go to those games, it might be parents out there looking for ways to make their son or daughter better.
Exactly.
And then they meet you and look now.
Look, that's a perfect opportunity. Yeah, for sure. And the biggest thing with me is I built my practice off of social media and word of mouth. I don't pay for any ads or anything. Everybody that's got exposed to me hasn't been from ads. I mean, I have a Google search that you can obviously type in Darby Chiropractic Sports Performance.
Well, they're just good to have as far as being business.
Yeah, business. Right. But
especially
as far as
a doctor, you have to a certain thing. When you call yourself a doctor, it's certain things that people need to see when they go online.
Right. Exactly.
You have to have a headshot. Like if you tell me you're a doctor and you ain't got no headshot, I'm like,
I'm a little worried.
Where are you on? Like, where are you with your suit? Like, where is that?
Yeah,
you told me you was a doctor. Like,
you got to take care of the small stuff for sure.
Yeah, that little stuff.
But like I said, the biggest thing is word of mouth and just putting myself in front of people. That's why a lot of people why as a chiropractor, why are you going to these softball games and baseball games and track meets?
Because you want to be in sports.
Yeah, and again, the thing is I enjoy the success that I see out there. Biggest thing is a lot of patients or athletes come to me and they're coming to me limping, hurting, in pain, talking about their problems. But the biggest thing is to actually go to these track meets and baseball games and softball games and actually see them perform. It's a blessing to actually see that I actually play a part and just getting them that 1% better.
And not only that, you're going the extra mile because especially if you have patients that are out there performing, you can look at them and tell them what, like, oh, I saw you doing this, but you need to do this differently,
right?
And things like that. Like if you have a patient that you're working on that does bodybuilding, you can say, hey man, when you're stretching, you shouldn't stretch this way, or you know what I'm saying, you're not squatting properly, or things like that. You're able to notice those things.
The small things. And the biggest thing is I don't try to become somebody's baseball coach. Or,
yeah.
Or I don't try to become the coach that for bodybuilding. But if I see the small things, I put my 2 cents in, and then it's a back and forth. I feel like the biggest thing I stress in my practice is communication. It's a back and forth communication. I'm steady learning, and I haven't reached my full potential. Yeah, I'm a doctor. But at the end of the day, I'm still growing. I'm still learning. You can teach some of my bodybuilders can teach me how to really isolate a certain muscle because that's their life. That's how they train. And then even some athletes, they may tell me about something about speed and agility that I just don't know. Gotcha. So the biggest thing is it's changing, and muscles don't change. Muscles have the same action and everything. But the biggest thing is even from a doctor standpoint, I'm still not a finished product. I'm still learning and growing even from them.
Day.
Exactly. And they might see something. They be like, hey, I might see something. I might make a comment on, hey, you should be doing this stretch, and be like, oh, well, I do this stretch because I don't feel the other stretch in a certain area. So gotcha. I'm like, oh, okay, that makes sense. So let's focus on that. Let's focus on glute activation in order to make sure that we feel some groin area stuff, some things like that.
So people that's thinking about going to a chiropractor or not, what are some lifestyle changes and exercises and movements that you can tell people to do just to on a daily on their own, just to just feel better and move better?
Man, so movement.
Just keep moving. Okay.
Movement is key, man. Like I said, I have a lot of when I relate to athletes, everybody's an athlete. Everybody's picking up something. Everybody's, whether it's a grandmother picking up a grandbaby, that's the same thing as an athlete picking up a 45-pound weight. You know what I mean? It's just more or less everybody. Movement is key. Movement is butter. So the biggest thing is if people don't take nothing from me from my practice. When you come to me, I am promoting range of motion. I am promoting movement. And again, in order to get better, you have to move. Most people say, well, oh, you need to rest, or, oh, you need to sit down. Or like I have some patients as old as 75, 80 that I still encourage them to go cut their grass. Obviously, you got to be smart, right?
Yeah,
you got to make sure that
your heart is not as good as it was.
Yeah, for sure. You got to be smart. But the biggest thing is movement is key, man. And the biggest thing is whether you're an NFL guy or just somebody just trying to wake up without pain, you have to learn how to move. And most people think that if they have a labor intense job, that's movement, but it's not. It's a different way that you train when you actually go to the gym versus going to the plant and doing scaffold building or something like that.
And then another thing is people try to use their job as an exercise. Yes, it's an exercise, but at the same time, you're doing the same thing every day.
Right,
so
exactly.
It's like you're moving the same muscles. Of course, you're going to get real good at that.
Right,
of
exactly.
Course your body's going to do this for you because it's like, okay, your body's going to be like, okay, I know what I got to do today.
Right,
and it's good at moving in that
same
taking
direction.
This box, putting it here, taking this box, but all the other movement you're losing.
Yeah, exactly. If you don't move it, you lose it, man. And the biggest thing is like I told you before with, my NFL guys who train quads and hamstrings and don't train glutes, man. I mean, by all means, they know how to go up and down. They know how to go forward, but the lateral movements they struggle with.
Same thing. Like when you say lateral, you just talking about like just
just moving side to side.
Or turning.
Biggest thing, yeah. So when I say lateral movements, just moving side to side.
Okay.
Pretty much, like for a DB, for instance, like a DB has to have the right amount of hips and a hip range of motion in order to move in the right direction to turn. Yeah. But even then, like if your repetitive motion at a job, a daily job, just picking up and like you said, picking up and going this, or I'm always walking in the forward direction, but I don't train any lateral movements, then you're not going to be able to maximize your body to the best. Okay. The best, and then what's great about it is that your body communicates with you. It's like, hey, I got hip pain, but you got hip pain because you don't move it. You don't move it enough.
Man, that happened to me about a week or two ago, man. I was editing on the computer. My phone was behind me. It started ringing. I reached back and something happened. I don't know what happened. Something happened. So I had to literally stay just like this for about 3 minutes. And then when I breathe in, it hurts. And then I was just stuck. And I was like, man, what the heck am I going to do? And every time I try to move, so I had to just stay there for about 2-3 minutes.
Right. Yes, but you ain't, away. How many times do you do this a day?
I did this. I reached behind myself. Right. And I was just like, bruh, like, what the heck happened? I don't know. To this day, I don't know what the heck, but it pinched. But anyway, so yeah. Like you said, if you're not moving certain muscles, that happens, and I figured that out 2 weeks ago.
For sure. Like I said, man, if you're not moving it, you're losing it. So the biggest thing is, as far as people just maximizing their body or getting the pain to be gone, you have to make sure that you're moving in that certain direction multiple times a day. So biggest thing is when I give a athlete or give someone an exercise, I'm trying to train those movements that they normally don't do on a daily basis.
I did want to talk about patient safety, and because I know that's an important things for you. What are some of the risks with going to chiropractic therapy, and what do you do to avoid those risks? To avoid things happening like patient safety and stuff like that.
Oh yeah, so man, the biggest thing is I'm very thorough when I do my exams. Okay. Biggest thing is when you're a chiropractor and you're trying to be time efficient, but you're also trying to get the next patient in the door. The biggest thing is chiropractors don't be as thorough as they need to be in order to see something that they would normally see if they
just getting in emotions though, because we all do it. Sometimes you get in emotions. Okay, I got this patient coming in, boom, 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 adjustment. All right, adjustment out.
Right, yeah, but just being thorough and making sure, because my malpractice insurance is probably the lowest out of all doctors, because the probability of me killing you is slim to none. But if you don't spend time with your patients, you never know what they were going through. And the biggest thing in chiropractic is most people think that you know, adjusting somebody can cause a stroke, whatever. But somebody probably was actively stroking who came in with left-sided arm pain or whatnot, and you're treating it as just left-sided arm pain, and but really it's something else. But you wasn't thorough. You didn't do your cranial nerve test. You didn't do all the tests that you needed to do in order to catch that thing right before it even happened, and then you go in and adjust this patient, and then all of a sudden now the chiropractor caused a stroke. No, the chiropractor missed a stroke in progress. So the biggest thing is when it comes down to patient safety, from a chiropractic realm, man, it's just being thorough. Being thorough and making sure that I know that person. Because again, typically my first visits are like about 30 to 45 minutes long. And I'm trying to make sure that I'm getting to know that patient and what their body limitations are and things like that. And then as I build on working with a patient, I can definitely see exactly on how I need to move them in order to keep progressing them. So patient safety is not really big. I mean, obviously, I'm trying to make sure nobody fall off the table or whatnot when I'm adjusting them. But the biggest thing is that's pretty much the limitations of it all.
Okay, so when I was at your space and you were adjusting the patient and working on one, you were saying how it was a picture, and you were just saying how he moves this way, so there's no need to just keep trying to train the other way and things like that. How important is it to tailor what you do per patient, like instead of just keeping it the same for everyone?
Man, it's very important, man. And at the end of the day, I look at every individual athlete as an individual. Yeah, they may play the same position on the same team, but by all means, they may have different issues that they're dealing with. So the biggest thing is I tailor treatment in order to make sure that I'm maximizing each individual person. It's very important. I don't want to become a machine. I want to continue to be a doctor. Most people think that like I put the same cups in the same area on some people, but I have a way a method as to why I do what I do. And the biggest thing is when you give an individual care, then you're maximizing that person. Besides just throwing cups on somebody's arm and giving them the same adjustments and just sending them out the door, expecting different results, which it's not going to happen. I mean, you may weed some things out; they're going to feel better, but are you really maximizing their body, and are you really making sure that they're reaching their full potential as that individual athlete? So it's very important just to tailor certain treatments towards certain athletes.
What are some things that you're doing to, like you said, you're learning every day, getting better every day. You're not perfect. What are you doing to keep yourself up to date with things, with technology, medicine, and learning your craft more?
Man, yeah, research is real big, man. Biggest thing is to continue to grow, right? So in order to grow, I got to continue to learn. I got to continue to learn from people in the sports performance realm. It's not just learning from people, research from chiropractors, but learning from research from physical therapists, or learning from research from athletic trainers or personal trainers. Just honestly continuing to grow. I also have a couple colleagues that I reach out to as well that I entrust that's also doing the exact same thing. So like I have colleagues of mine that work with like bodybuilders, or like really specify on working with bodybuilders, right? So the biggest thing is if I have a bodybuilder that comes in that I don't typically work with, or having an injury that I don't typically remember,
you have people that you can reach out to for guidance and just consult with them to see what's the best proper way to go about treating these type of patients.
Right. And it's like this is like a group of about 5 docs, man, that I really trust. And 2 of them are older, and 2 of them are like, or 3 of them are like people that I went through school with. That literally that practice a little different than I do.
Got you. So as the future for Dr. Darby, like what do you see in the future? I want to go 3 years from now, and then I want to go bigger. I want to go 10 years from now. Like, what do you see your practice at 3 to 5 years from now?
Man, all right, 3 to 5 years from now, man, I definitely want to continue to grow my mobile practice. I definitely have a passion for traveling, and I have a passion for just treating high-end athletes. So hopefully I can work with different NFL teams or any professional team in order to try to make sure that I'm exposing them to chiropractic, because some people make it all the way to the pros without even being exposed to a chiropractor. So the biggest thing is yes, about 3 to 5 years, growing my mobile practice, but also just in this area alone, just making sure that I'm touching everybody from every aspect of sports. That makes sense. So as far as just really getting the practice here in Beaumont.
Got you. So also, What is some advice that you would give someone that's no. Let's talk about the 10 years.
Oh yeah. So 10 years.
So 10 to 15 years. Let's talk
10
about
to 15 years from now, man. Dude, if God says the same, man, I got $1 million practice, man. Have $1 million practice. And I mean, obviously revenue is not the key, but the biggest thing is if I'm servicing a lot of athletes from literally the Golden Triangle,
that should be easy.
That should be an easy thing to accomplish.
Yeah,
for sure.
Got you. So someone who's looking into being in sports medicine, looking into being a chiropractor or things like that, what is some advice? Because I was with you and you were with someone and they were saying that they wanted to be a physical therapist and you were just talking about that route versus being a chiropractor. So talk about that a little bit and then give a little bit of advice to someone who wants to get to a position you're in and be a chiropractor.
Yeah, so man, physical therapists, they stay along the realm of like really working with insurance, right? So that looks depending on the practice. So if it's not a PT clinic that really specifies on working with younger athletes, working with that type of demographic, instead of working with the geriatrics, which is just the older people,
gotcha.
Then you kind of limit it, right? You kind of stuck as a PT, kind of doing the same things over and over and over.
And they can't open their own practice, can they?
Yeah, so they can. You can have a PT clinic. Yeah, you can have a PT clinic. The biggest thing is they're limited as far as getting imaging taken care of, like as far as like actually being a portal of entry doctor, may I say. So portal of entry doctor is where literally you can call me and you can come in to see me directly versus PTs is more of like a referral base. So you go to your primary care provider and then you get referred to PT, or I can also refer to PT.
So what advice do you normally give people who want to be into the sports medicine realm? And because it seems like for some reason being a PT is more famous. Like everybody said, okay, I'll be a physical therapist. Like for some reason, is it the same amount of schooling?
So no, chiropractic school is a little longer.
It could be because they feel like it's an easier route.
Yeah. Well, no, because most people are exposed to physical therapists first. The biggest thing is chiropractic is growing and developing into more of an evidence-based practice, may I say. So using the technology, using the research in order to advance. Besides, there's some studies in chiropractic that really believe that chiropractic care can heal other things, more or less, like cure cancer or something like that. But the biggest thing is that's not how I practice. I really focus on really honing in on evidence-based practice and how can I give people the tools in order for them to develop to the best of their ability. So when it comes down to chiropractic in general, I would encourage everybody, like if you're going to be in that sports medicine, sports performance, and you still want to be a doctor and still want to be able to service athletes or service the general public in all aspects, become a chiropractor. Because again, PTs can adjust, they can mobilize, may I say.
Yeah.
But we're the best at our craft because that's what we do. That's our main tool. And then also we pick up stuff like dry needling, pick up stuff like soft tissue modalities, stuff like that, in order to make sure that we're advancing our athletes or the general public.
So someone that's in high school right now and said, you know what, I want to be a doctor, even just a doctor, it doesn't have to be chiropractor. What advice would you give them to just go ahead and like, as far as schooling and the route to take to get to that point?
Man, develop a plan. First of all, you need to know what doctor you want to be. Because the biggest thing is there's different prereqs for that stuff, right?
Okay.
Different things that you need to do in order to prepare yourself for the next step. So, I mean, I definitely want everybody to be a chiropractor. But the biggest thing is really doing the research, understanding what college you're going to, what degree plans that college holds,
what classes you need to take,
you need to take to prepare you for the next step, and then what is the requirements for the next step.
So basically, what you're saying is it's good to go into like medicine and anything as far as the medical field, knowing what type of this you want to be.
Right, for sure. Yeah, knowing, like, obviously I wouldn't say go get a sports medicine degree if you want to be a nurse. You know, you need to be doing prereqs for nursing in order to become a nurse. And then people go the route of LVN or RN and then nurse practitioner. I wouldn't be saying go to chiropractic school. You know what I mean? But the biggest thing is just making sure that you have a plan in place.
Gotcha.
Plan in place.
Got you, man. And I want to thank you for coming on to my show today, for real.
Hey, man, I appreciate it.
It means
man.
a lot. Hey, it was hard time coming. We kept getting we got like 2 or 3 reschedules, but it's okay though.
Facts, man.
It happened, man.
I appreciate you having me.
No problem. And until next time, man, be for real.
Already.